Joining us right now is House Speaker Mike Johnson. And Speaker Johnson, thank you for being with us today. People had been waiting to see what you would do, and you decided to go with the more conservative part of your party, to the consternation of some moderates, including Mike Lawler. What happened? What made you decide to go this way, and what do you do with the moderates who are unhappy with this decision?
Well, it wasn't the Speaker's decision. It was consensus of the body. We have 220 Republicans here, and lots of different opinions, lots of different dynamics in their districts across the country. This extending of the COVID-era enhanced subsidy, the premium tax credit, has been a big issue around here of debate for months now. We knew that we were coming to the end of the year when it would expire. And remember, the Democrats created this COVID-era subsidy. They are the ones that put the expiration date on it. And now they're turning to Republicans as if we should save that in some way. We couldn't find consensus on it with the body in order to pass it. Here's the reason. Everybody needs to understand there's a false narrative out there about these subsidies. It's subsidizing insurance companies. And when you do that, you're masking the cost, the rising cost of health care, and you're making the premiums rise even further. But here's the false narrative. The Democrats are pretending as though this affects everybody in the country. It affects 7% of Americans, this extended subsidy. And of those, even if it was extended without any reforms at all, it would only reduce that small group of Americans' premiums by 5.7%. The Democrats have tried to pretend as though this is all about
Americans. No, I understand that this is not for everybody, but it's 22 to 24 million Americans, and there are some Republicans whose districts are going to face some real trouble and some real issues with this. We've talked to some of them. I understand that Mike Lawler from New York was particularly upset yesterday, that he was kind of furious about it, said it's idiotic, it's political malpractice. That's what he told Axios on some of this. They said they could hear him yelling from outside the room yesterday where all of you were meeting.
Well, no. I was in that room with him, and Mike Lawler's one of my close friends. In fact, I was with him in his district in New York City just 2 weeks ago, campaigning for a couple of days, raising him money and helping him get reelected. He's an essential member of our conference and a really smart guy. And what he was arguing for is this 7% of Americans. But here's the point. What we're going to do today is the first of multiple steps to help not just 7% of Americans, but 100% of Americans reduce their premiums, actually reduce their premiums, not subsidize insurance companies to raise the premiums, but reduce them. And the first of those votes is today. This is the Lower Premiums for All Americans Act we're going to have on the floor. And it's going to actually achieve, if it's signed into law, exactly what we're saying. It has many components. Among them are the cost-sharing reduction programs, which will reduce all premiums across the board by at least 11%. And by the way, save taxpayers tens of billions of dollars. We have the Health Association health plans that will be a part of this today, which will give more flexibility to small businesses and others and insureds in the marketplace. You've got PBM transparency as a part of this, and the choice accounts. So there'll be a lot more flexibility in the system. Consumers will be able to have more choices, and their cost will go down. We'll also increase access to care through these reforms. And again, this is just the first of many. We're going to do more of this in the first quarter of next year. Republicans are the ones who will fix health care. It is the Democrats who broke it. Remember, when they passed Obamacare, the Unaffordable Care Act, it was 15 years ago now, they promised us that it would enhance care and that premiums would go down for everyone and you'd have more choices. None of that was true. So we have to fix it. Republicans are the ones with the ideas to do it.
I hear your point that these subsidies would only help a portion of the people who are dealing with much higher premiums with health care. That's certainly fair. But to be trying to change the health care system at a point where the subsidies are going to go away and raise insurance for 22 to 24 million Americans, premiums starting in a couple of weeks, the moderates on both the Republicans and the Democrats have said, okay, we don't want to necessarily go along with extending those for 3 years as the plan laid out by Hakeem Jeffries, but why not do a 1 to 2 year extension while you're trying to make some of the changes that you're talking about? Because these changes are coming so late, because they're not things that are going to bring down premiums tomorrow, why not extend some of those and try and find some way to blend these two sides to say, okay, we're going to try and change the healthcare system and bring down premiums for all. It's not going to happen overnight. So in the meantime, we will extend these subsidies.
Well, a couple of important points. First of all, the subsidies are not going away. And again, this is an enhanced subsidy on top of the subsidy that everyone already has. And again, even if it had been extended for 3 years, as Hakeem Jeffries proposed, with no reforms, they would these same people who are achieving that and having that enhanced subsidy would only get 5.7% of savings. The point is, everyone's premiums are going up because the Democrats broke the system. The very people who are trying to continue to subsidize it and put more taxpayer dollars on a broken system are the ones that created the mess. We are coming into the middle of that to reform the system, to look at the root causes, the root problems of why everyone's premiums are going up. And yes, that takes a lot of hard work. It takes a lot of consensus building here, especially at a time when we have razor-thin margins. And no one on the Democrat side wants to do anything to actually help the problem. They don't want a solution to this. They want an issue for the upcoming election. And they have put all their chips on one slice in the roulette wheel. And their whole game is to try to blame healthcare costs on Republicans, which is comical when you look at the facts. They are the ones that broke it. They are the ones that continue to add to it, and that's what we're trying to address.